Hi, my name is E. Crawford. I'm a professor of urology, surgery, and radiation oncology at the University of Colorado in Denver, Colorado. This is really an exciting time in the arena of prostate cancer and molecular markers. I like to look at these markers that go in one of three areas. One is to assist us in diagnosis of prostate cancer, and these markers include our one that we're very familiar with, PSA, but also a couple of new ones that are coming out. One of the ones that we've been working with and very excited about is called the MDx marker. And what this marker does is you get the paraffin tissue from the negative biopsies. Then tests are done looking for epigenetic changes. And what occurs in a halo around areas of prostate cancer frequently are changes in normal cells, and it's called methylation. A biopsy will come back and it'll say, okay, we've got evidence that's in the surrounding area there might be prostate cancer, and this helps us determine when to do another biopsy. An example is a 46-year-old man I just saw who had a PSA that was elevated. He did have some urinary symptoms. He was treated with an antibiotic. The symptoms got better as PSA went down, but it was still elevated. And 2 years ago, his PSA was 2.5. 2.5 is a high PSA for a 46-year-old man. Ended up getting biopsied. The biopsies were negative, and the urologist said, well, come back and see me in 6 months. We'll take another look. He had a family history of prostate cancer. His prostate volume was about 40 grams. Repeat PSA was still was below 10. We sent off the original biopsies for this MDx methylation test. In fact, what happened was it came back positive in 3 of the 12 cores that were sent to them. And these cores were located in the apex and the right base. So what I did is shared this information with this man, and he underwent rebiopsy, directed biopsies of these areas, and I also did 12 other biopsies just to be sure. And what happened was this test accurately identified the region where the cancers were. And so we got a report back, 3 positive biopsies, Gleason 6 cancer. So this is a test that's helpful in patients that have had negative biopsies where you're concerned about the presence of cancer. The next thing the patient asked me, he said, is there any other tests that can help me determine what I should do now that I have prostate cancer? He was actually relieved that we found this. He just said I would have lived on pins and needles for 6 months waiting to get another biopsy or have something done. And so he was grateful that we found it. He said, well, and that's the next area where molecular markers have been helpful. There's a couple tests that can be done on the tissue then to determine the aggressiveness of the cancer. So you can stratify Gleason 6 cancer as low risk or high risk. Sort of in summary, it's been an exciting couple of years here in prostate cancer with new markers that help us determine when to biopsy somebody, if they've been biopsied and they're negative, when to keep looking, and then when we find a cancer to help us determine the path to go down, whether it be active surveillance or an aggressive therapy like radical prostatectomy or radiation.